We may not have, but we
One
may have crossed
time
that.
at the Peabody Institute Library in Danvers, maybe?
That is good memory. Yes, I think that was.
Okay. Hi, Jerry.
Nice to see you.
Hi, Paula.
Hi, Peter. Hi, everybody.
Hi.
I think that's Christine with the hand.
Hey, Christine.
Yep. Yes, hello.
Hi.
Kevin said he might be coming late tonight.
Who might be coming late?
Kevin Sexton.
Okay. Well, we can get started when Carrie comes on.
Excuse me for just a minute. Paula and Jerry, thanks for sending in your paperwork. Thank you. Thank you.
Oh,
It's important.
I was thinking, what paperwork?
Yeah, no, stability is important to me, at least right
Yeah.
now, especially. Mark, we heard from Sam. He said he may be here, may not be here. I don't know if you've heard anything, but
Yeah,
okay.
I saw the email from him, but sounds like he might try if he can.
Okay.
We'll give Carrie one more minute and then we'll get started. Paul, I see that you're on the agenda for the Memorial Day services. Have you done that before?
No,
No?
no, and I hope I can represent us well.
Yes, I'm sure you will.
Absolutely. Thanks, Paula.
For sure.
Sure.
I'll be there too. I'm the designated photographer.
Oh, really?
Oh, then we
Not
will
because of my
be there.
photography skills, because of my price. Free.
Yeah. Can't get beat. You can't beat that.
It's always a really nice ceremony, and on the
Yeah,
town.
it's too bad we're still not where we should be.
Hmm.
It's nice on the town common. Very, very nice.
Hmm.
Beautiful backdrop.
It's always
And
next.
yep. I used to march in this parade when I was a campfire girl.
Nice. I love it.
Okay, well, why don't we get started? I'm sure Carrie and Kevin will be along. So I'm going to call the meeting to order. And in terms of tonight's agenda, we have public comment. It doesn't seem like anybody from the public is on. And then we're going to go right into the MAPC proposal with Barry and Mark and Peter. This is the follow-up from our last meeting to sort of make a decision to kind of move ahead or not. Then Jean's going to update us on the grant proposal from the state, which has had a sort of rock up and down kind of history. Hopefully Kevin will be on by then and can update us on the Writing Coalition. We'll hear about the health director position status. We have the minutes that everybody received from last time. We'll go over those. And then the health division monthly report, Peter sent it out about an hour ago. If you haven't seen it, it's on your email. And we'll take a look at that and the usual COVID updates and wrap up. So why don't we just move right along to the MAPC proposal and review. I don't know, Peter, how do you want to do this?
I would start by saying I just heard from Carrie and she's having troubles with Zoom.
Oh.
So she's going to be right along. I'd hate for her to miss, this is kind of her, what do you want to call it? but she's a favorite son of this. I mean, that's not the right language. So maybe we can have a pause and move to, I don't know.
Well, we probably should want to be here for the grant proposal.
Yeah.
Kevin isn't here for the coalition update. Maybe Jean,
Few of them.
health director status.
Yes, sure. Thank you. The health director job description was in your packet. So you can see that we are, at long last, we are there. We are moving forward with posting. The various organizations, we're going to be having HR post not only in the usual places, which is the Mass Municipal Association website. I think they do some online posting. They put it on the website, but also the places like MHOA, and Peter knows the acronyms better than I do for the various health listservs, so that we can get it out to the public health community and make sure people are seeing it. So that is the plan for advertising. Obviously, hiring the health director and the range of goals and priorities, at least from where I sit, is the top priority. It is so busy, and we many kudos to everybody in public health, including this board, but it's so busy, and we just really need this full-time position filled, and
Yeah.
it's time.
Yep.
So it's very exciting, and I've been working on the budget, as I had mentioned, the funding that I know we're going to get to with the internal assessment. I've been working with the town accountant to make that as seamless as we can, so that even though public health moves over to a different budgetary line item, that purchase order that we're going to create will migrate over. So there won't be any issue between what's falling in public services budget and the new independent public health budget, which worked out. So I was glad about that. And yeah, we're just very excited to start the process and get the hiring going. So that's my part.
Could I just add one thing, Mr. Chairman? Word of mouth works too, as far as the recruitment process. So I'm looking at Mark and Barry here. Nothing against your employers, but this town is a very exciting place to be right now if you're in public health and not old like I am.
Yeah, we could definitely circulate the job description and posting. Glad to do that to folks we know.
Yeah, Barry, we know Barry. He's sitting right here in front of me. If you ever thought about being a health director, I'm not that proud, Mark. I steal people right from underneath your nose.
Wait a minute, man.
Okay, we got Kerry on board.
Yeah, I just want to say one other thing about, hi, Kerry. I like your background there.
Can't hear you. You're on mute.
You're on mute.
Try to unmute.
Unmute.
There we
There
go.
we go.
Yay.
I had to switch devices. Yeah, this is I'm at the beach now. Not really, but sorry to be late, but here I am.
That's great. And so I did, I just want to let people know that I did follow up with Bob around, how the board would have some input into the recruitment process and so forth. Obviously, it's a management hire, so that's Bob's prerogative. But we definitely want one or two people on the board and somewhere in the process to be able to give input and feedback. So we'll see how that plays out. It's really obviously very early at this point. Yes, Jean.
Yeah, I can jump in a little bit because I talked to Bob too to say, let's talk about the game plan, because we haven't hired a department head in, well, I think about 6 years. We had to wipe the cobwebs away to remember how we did it. And the way we've done it, and Bob thought this might be something that the board would want to hear about, is we've had a hiring committee, for lack of a better term. And Bob thought one representative from the board would be good to be on that committee, and that committee would be the hiring entity to hire this position. So sometimes we do different things, and first interviews are these kind of people, and second interviews, you know, it's the town manager and somebody else. But we thought having a hiring committee
Right.
that would be reviewing resumes in the first interview and in the second interview, and kind of follow the process might be a good approach to that. And having one representative from the Board of Health would be the goal.
Okay. Okay, that's good.
If I may, Rick.
Yep. Sure.
I remember that conversation. I remember talking about that. And one of the things we talked about too, reviewing the notes, was that maybe one member from the board, and whether or not it would be valuable to have a previous chair on board. And I know we had some discussion about it. Kevin, I remember Kevin and Paula sort of saying, oh yeah, maybe if they're interested. So I don't know if that has gone by the wayside, or if there's maybe not interest, I don't know, but I just wanted to remind folks of that.
Okay. Let me let me follow up with Bob and see. You know, we had mentioned a number of different other folks who might, you know, have input. I think someone mentioned community members and so forth. And let me just talk to Bob about how that might play out. You know, it could be that there's a small hiring committee, but there's a sort of second group of several people who, you know, are provide input in the process. But I want to understand his thinking, but thank you for reminding us about that. I'll have to go back to the minutes of that meeting, because I remember there was a community member, previous board chair. There might have been one or two other sort of stakeholders in that. So we'll have to see. So we skipped ahead to item number 7, but we're going to go back now to item number 4 on the MAPC proposal. And again, I'll turn it over to Peter.
Well, you know, all I can do is introduce Mark. We received his scope of work, and you guys all have a copy of that by now. And it also includes a timetable, which I thought was useful.
Yeah.
So, I mean, without further ado, I'm happy to turn it over to Mark. He knows what's ahead. And, you know, I hope everybody's feeling the same way I do about this, that, you know, let's get this ball rolling finally, and then we can just, you know, monitor on a month-to-month basis as appropriate. So Mark, why don't you sell us on that from there?
Yeah, sounds good. No, thank you, Peter. Good to be with you all again. And, you know, I think, you know, we kind of did brief introductions with my colleague, Barry Keppert, who's the public health director at MAPC, and, you know, was almost recruited by your town a couple minutes ago.
I'm not done yet either. I don't know you well enough to have introduced you, Barry. Forgive me.
That might dent our ability to do this project, but hey, you know, maybe it'll work out. But anyway, yeah, so I mean, we sent around a draft scope of work, and it did reflect, I think, some of the feedback that we had gotten when we presented a month ago. And I think, you know, was somewhat based on what we had provided as part of the RFP response in November, and kind of adapted that in some ways to kind of fit the, you know, the scale of the project appropriately. But if you'd like, I could go through it, or, you know, if you guys have already looked at it, you know, carefully, we're glad to take any questions you have on it, but let me know which way you'd like to go. You know, if there's any questions on what we.
No, they didn't receive the packet, Mark, until yesterday afternoon. Maybe we can do a short line version.
I appreciate
going through
that.
it, and then give us time to formulate some questions.
Yeah. So I can kind of speak to sort of the main components.
Do we want to try a split screen here? I don't know if I can.
Right. Yeah, if you'd like me to share my screen, if somebody makes me a co-host, I can do that.
So that's Jean's job, I think.
You can just go ahead and there's no issue.
Okay, there's no barrier there, okay. Yeah, so hopefully people can see that now. But this was
Yep.
the document we had circulated. Yeah, and I guess I'll just start with sort of, the objectives, and then we can talk about, some of our staffing, including the participation of Sam Wong, which we had discussed last time. But I'll start with the objectives. And the objectives, are based around, what you were seeking in your RFP and some of the comments you made to us last time. So, the first being, conducting the internal assessment of Reading's delivery of public health services. I think, important to you all, and obviously a key piece of this would be assessing the performance of the health department in fulfilling statutory and mandated public health services, and considering that in the context of state standards, including workforce standards. And then, lastly, like providing recommendations to strengthen, the town's public health, services, and hopefully get those in line with state standards to the degree they're not already there. So those were, the objectives of what we'll try to do. And, below that, we just kind of set out some of the ways we do that. Obviously, like part of this would include looking at the health department's budget, any charter ordinances that impact that, the health department, the structure and staffing of the health department, the volume of work the health department has, and then also the kind of delivery model, how in the round you would kind of describe the department's, delivery model. Part of, that work would include interviews with up to 10 key stakeholders. So, obviously, the Board of Health is a key stakeholder, health department staff, and other folks that you identify. And that could be, other lead town officials, town management, but other folks that you think are worth engaging in that context too. And it could include, non-government officials as well, obviously, like coalitions or other partners you work with that might have views. I think we talked about documenting peer community service delivery models and trying to compare Reading with those. So we would pick 4 communities to do that for. And then I think, we'd really look into, what are some of the standards that the Special Commission, on public health has developed and try to examine, the workforce capabilities of the department and whether, statutory and regulatory functions are being, carried out. Obviously there's a very long list of those statutory and regulatory functions, but, we would use that and use, what the Special Commission has devised to make those assessments. We are somewhat familiar with, some of the tools that have been devised as part of that work because we've been the recipient alongside, groups of communities with Safe Act grants this year. So as part of those, we are actually doing similar assessments, maybe not quite as in depth, but similar assessments to what this would entail. We would be presenting an analysis of the findings, back to the Board of Health and to the health department leadership, and tell you what we've seen in the data, the evaluation, and interviews. And, from there, I think we look at some models to address, strengths and areas for improvement. And I think, part of that would also be, exploring how the shared service arrangement with Linfield and Wilmington can work, because congratulations, we know the grant was awarded, which is great news. And obviously, has to be a key part of what we look at. And then, we'll wrap it up with kind of a final memorandum, that brings together the information we collected and the considerations, but also provides recommendations. And, we'd be glad to, not only provide that, in written form, but come back before the Board of Health to present on that too. And I mean, I would say, overall, we're glad to, as the program of work progresses, we're glad to bring that back in front of the Board of Health, for periodic updates as well. So that is the main task. And as far as, timing goes, we just kind of provided sort of a breakdown by task and over months. So this would be how we would, look to do this work between now and November. I mean, I would say, and just, if you're wondering why the kind of duration and length, we are carrying a really heavy workload with a lot of wrap up of grants and other things now between now and the end of the fiscal year. So while we'll get this work started, obviously, finalizing, our contracting and getting the project launched and beginning to do some of the info gathering in June. I think a lot of the work from there would probably be, in July and from that point on, just because we do have a fair amount of wrap up with some of the ongoing grants and projects we are working on with that fiscal year deadline in mind. So that's how we kind of see this, working, and we're glad to take any questions and try to provide answers as we can. Yeah, let me just ask if Barry, my colleague, has anything to add, on that. But
No, I guess I would just add real quickly too that it is a really kind of opportune moment for Reading to be doing this, given kind of the realignment. I think so. To Mark's point, congrats on the grant that you all received in terms of the shared service work. But to orient around essentially kind of more credentialing that the state is kind of pushing for, so that we are really kind of finding ways to kind of support and encourage kind of the real kind of professionalization of the public health field. There's a lot there, but it's kind of bringing us to that particular point as well too. And delivering those standards that not only kind of meet the challenges and kind of statutory requirements of the moment, but future looking as well too, because we know that there's kind of other things presenting themselves. So just really opportune time to be doing this work, and excited if the opportunity presents to do it with you all.
yeah, and I would say just, on the point about, I mentioned Sam Wong, and, we did, after our last Board of Health presentation, we did, engage with Sam about this work, had a really great conversation, received some feedback that he had. And also he did, look at the scope of work and provide us feedback on that too. And Sam would like to be a, resource for this work going forward. He wants to be a subject matter expert and kind of provide, a level of support in looking at, the pieces of this work as it progresses. And, we have a, high regard for Sam and his experience, and, welcome his, his involvement, and he is willing to do that, which is really, great for us. So,
Right.
So yeah, any questions you have, glad to try and answer.
Can I ask, in terms of the 4 peer communities that you would be comparing with, I'm presuming you would select communities that not only are of similar size and kind of generally look alike as Reading, but also ones that are high performing in this area. If there's a way to measure high performing, or I don't exactly know if that's word of mouth, or the state does something to give grades, but obviously we want to be compared to high performing, because that's where we want to go.
Yeah. Oh, go ahead, Barry. If you.
No, I would say yes. I think we can definitely look for that part of it too. And we're often in constant contact with the Office of Local and Regional Public Health at DPH too, so we can do some scanning, as well as we work quite closely with the Coalition for Local Public Health, which involves Mass Public Health Association, Mass Association of Health Boards, Mass Health Officers Association. So we can also kind of tap into that knowledge. The one thing I will note is that, again, as you all probably know quite well, kind of the unique configuration of municipal departments from town to town. So the one thing I think we might check back with you is to say, we can look high performing, yes. We can also kind of keep in mind too, if you want to see kind of a spread of different kind of organizational arrangements, because in some ways understanding some of those relationships can also be helpful to think about what would kind of fit the context well, in terms of where the relationship are with certain functions are to the Board of Health, how it's emanating from the health department, how it might connect to other departments. So we can definitely do that, but we may also come back with the consideration of essentially what configurations you might want to see, so that you have that kind of informed kind of perspective as you kind of think about where to evolve.
And one other question was around who you would interview in terms of stakeholders. And I wonder if, just generically, obviously you've done this in other communities, and we'll have to identify the Reading, but sort of generically, beyond the board and the health division staff, and like what types of community organizations or entities or groups or agencies would you typically interview as part of something like this?
Yeah, well, I mean, I think it definitely could be a range. I mean, it somewhat depends on maybe the emphasis that the town places on certain relationships, but I mean, in the case of like Salem, where we did sort of a similar project, I mean, we interacted with folks from their area hospital, from their community health center, from some of the folks who are involved with coalitions that are public health centered, like around like substance use disorders. Folks involved with that. Also, some of the kind of folks they regulate. So we did engage with chambers of commerce and the restaurant community, because obviously there's the inspectional side of that. I think in that instance, even some of the area landlords, because part of their focus was just on the way they work with those, the folks they regulate and kind of facilitate those relationships. And then I think like internally, it often was some of the departments that, are part of the process of approvals and, around permitting and other things. So, we talked to like, in Salem's case and, in most communities, there's a separate inspectional services, department. So we certainly engage with those folks. Oftentimes, health is one of the major, as one of the major, one of the permit stops for approvals on a range of, local development. So we talk to, folks just to see how health integrated with that process and whether that worked. And I think to some degree in that sense, it was like, the responsiveness of the health department and kind of the, skills and capabilities there. So that's kind of like some of the mix of stuff, but every community does have somewhat of a different, stakeholder mix, and we're, I mean, that's why I think we would look, to you to also see if there are parts of, organizations or individuals in Reading that you think really are worth engaging.
Great, thank you. Other questions from the board? Carrie, you're muted. Yeah.
Hi, Mark. Nice to see you again. Thank you and for that presentation. And hi, Barry. It's nice to meet you. We've been in a couple meetings together, but I don't think we've actually met. So, I just I had three things. Including a written report. To me, that was one of the key priorities in doing this work, because I envision this work as being a resource for future boards and future departments. And, it's I call them guardrails, and I think, helping document what the expectations were, what the basis of decisions were made for. So thank you. And I very much I see that as a key deliverable for this, in addition to the process piece. So thank you for saying that. I was glad to hear that. In terms of the Reading and Linfield piece, I think that's interesting and accurate. I know we talked about this a little bit at the last meeting. And I think our responsibility as the board for the community of Reading is making sure that we're identifying, with your assistance, what are the needs for the community of Reading, and then what are the methods by which you achieve compliance or however, and that would absolutely include, what are the opportunities and possibilities in our new shared service arrangement. So, but I just want to make sure that's, sometimes, I'm sure you know this, but some shared services, sometimes folks get confused about whether we're merging boards, and sort of, we have to remember that our scope remains solely within our town boundaries, right? So, great, thanks. I talk with my hands too, Barry. I love it. And shoot. Oh, right. Yeah, just to continue on with what Rick had raised about the possible communities. Yeah, I mean, it is tricky, and I think it'll be interesting to see. I wonder if you might be able to provide. Yeah, I know we have 4 on the list, but maybe could you provide perhaps 6 or 7, and with, these are similar or different and these are why, and then maybe there's a decision made. I certainly don't want to expand it into more than 4 communities, but as you say, I mean, some communities have school nurses in their health departments. Some communities have a full and special services division, some don't. There's a lot of variation, and understanding that as we look at these similars, I think would be important. Does that make sense? Is that possible? You're sort of having a couple to choose from and a little info background on the whys and differences.
Yeah, and sorry, Mark, I'll just say it's something we're constantly looking at how health departments are organized, and we do it. Sounds nerdy, but sometimes we're just doing it just to learn and kind of explore, kind of because there's so many variations.
That's my life. That's not nerdy. That's my life.
Yeah, so we have some of that on hand, and I think to your point, I think what we may be able to do is then essentially say the 4, we'll dig in a little bit more on them, but I think we could probably kind of bring a kind of a bit of a spread and then figure out where we want to focus.
Okay, great. Yeah, I mean, I don't intend to. I'm not asking for a lot more work, but I do think that there's some value in a little bit more information on a couple more. So that's okay. Thank you. Okay, that's all I had. Thank you.
And just along that same line, I could imagine go forward that we compile a list of stakeholders to be interviewed, and it will probably be larger than what you really are going to actually do, similar to peer towns. And so that might be something the board could weigh in to as well. Paula, you had a question.
Yes, I was just clarifying and confirming that as you do this project, that you might be able to look at other communities similar to ours that have the board under public safety, which is something new for us.
Yeah, and we could certainly explore that. I mean, I would say I think that's a fairly unique model, actually.
Yes.
Okay.
So
Yes.
in my experience, I can't think of a community that has a similar structure, but maybe I'm rolling through my quick Rolodex of communities that doesn't pop out, but we can definitely inquire and see if I mean, especially with people like Sam and the network, with the Coalition for Local Public Health, those are the folks who would know.
Okay.
There is something, so we could
Fair.
touch base with that. But I mean, I think we'd also love to understand that too, like what drove some of the decisions around how Reading decided to structure that, because I think it speaks to maybe some of how the community sees health and its relationship to other pieces of municipal government. I mean, those things, as much as sometimes structure, maybe some people think it matters more than it does, but it does matter. It definitely does. And
For sure.
And the funny thing about health is nobody seems to have the right answer. So there's plenty of and there probably really isn't a right answer for every community. There's what works for your community. So yeah, that's interesting to know, and we'd love to learn about what drove Reading's decision too.
Thank you.
Any other questions or comments?
Is your hand up, Gene?
Jean, did you have a?
Yes, thank you.
Sure.
Just a couple of points. The peer communities, I put something in the chat. We've done a lot of work with peer communities, and we have a guide that we follow. And there's 20-something peer communities that have been identified. So I just suggest that that at least be looked at when the peer communities is being considered. And then the other point I wanted to make was in reviewing the budget, we've done some similar studies. We did a needs assessment study for Elder and Human Services with the Gerontology Center at UMass, and they chose peer communities, and they looked at budgets, and they did all of the work as a comparison to the peer communities. So community X had this level of staffing, this kind of a board, and this kind of a budget. So it seemed to me like a lot of this would align under that comparative analysis of peer communities. And I didn't know if there was something else that you look at when you look at budgets. Is it per capita? Is there some metric that you use when you look at a budget to say, this budget seems like it's okay and this one seems like it isn't okay? How do you evaluate the budget, I guess was my question. Thank you.
Well, I mean, oftentimes, some of it's like staffing levels, right? Like to the degree that, a lot of budget is personnel. So kind of staffing, like, how many FTEs, where are those FTEs, and maybe, how that's breaks down. But I would say also just like the volume of work too. I mean, that is tricky because not every community classifies things in the same way or describes the work, but it is interesting to know like the volume of permitting work, the volume of, calls, just other forms of engagement, because sometimes there's not usually apples to apples comparisons, partially because each town is hard to, they will categorize things differently. They will do the work differently, but it is worth at least understanding like, hey, you have this level of staff and here's some of the kind of work volume that they're asked to do. So we would, I think part of our review would want to look at, permitting numbers and, calls, volumes and things like that.
And I was just going to add that, and some of it's also looking for kind of bright spots in other people's budgets, meaning essentially like how are they being creative, both kind of in the resources that they're deploying and the resources are coming in. So to Mark's earlier point, connecting back to the stakeholder piece, some of these conversations are also really important ways to learn about kind of shared investments, or the resources of public health don't always have to be financial. They can be the resources that someone provides either in like staffing or information, or there's other ways that those things, and that's not to say, I think to your point earlier, Carrie, that you're not depriving those core things that you really need, but in terms of thinking about what your goals are and how you might amplify them, the budget kind of can also kind of help how people are doing that thing. So you're probably doing it, but like one of the things that's clear in a lot of places that is like when they do flu clinics or when they do other things, they're using the Commonwealth Corporation, like Commonwealth Cares, to essentially kind of get compensation from the clinical side through like clinical reimbursements, insurance reimbursements. So there's interesting things that we can learn about those budgets as well that aren't just like they're spending this much and you're spending this much, but they actually might be getting resource or revenue this way, or they may actually be getting kind of a need, maybe like healthy aging filled because they have this kind of relationship. So it's also a way to reveal some of those other assets in there.
I certainly don't expect we're going to, we'll sort of, kind of look at the peer communities and be like, hey, here's who's funding the exact right amount and here's who's not. Partially because it doesn't often, they just don't generally play out that way. And unless it's glaring, but I would tend to think that's not the case in Reading and by comparison to other communities. But at least it's worth just seeing that is information, and what's behind it is worth understanding.
Carrie, you're on mute.
To that point, Jean, I just was looking, thank you for including that in the chat. Would the team from MAPC and even the board be able to access that Stone Consulting report to see what the statistical considerations were? Because that's really interesting. There's this work that's been done, so that would be useful to them. And then there's a way to differentiate it from, say, yes, we've looked at this list, and because it didn't consider X, we're bringing in this other community, or I'm putting words in their mouths, but that's how I would use a resource such as that. to know what the work had been. And then you said there was another group that had done some work on, I'm sorry, I missed the name, the elder services piece, was it? Yeah, it's same kind of thing. I mean, if there's, it seems like those might be helpful pieces of information for review, even just brief review.
Great. Jean?
Yeah, the elder services analysis, the needs assessment from UMass Gerontology Center, that is on the website.
Oh, good.
So I can send that link. That's helpful.
You can definitely find that. We've looked at a fair amount of their reports in the past, and certainly talked to them about some of that work before.
Jean, do we need a resolution to go ahead with this, or are we able to just? I mean, I'm feeling like the board is on board. The board is on board. Do we need a formal resolution or no? What do you think?
I think that this has been a lot of good discussion, but I think it always is helpful to have a vote if the board is going to support this idea going forward. That way there's no gray area that we're going to do this. And I might suggest that one of the things that we've done in the past when we've had a good outline of a project like this is, and maybe it's tucked in there, is to have a detailed work plan that would be something we would develop, in a subsequent time, because this scope is sort of a broad scope, and it gets us a good idea of what we're going to accomplish here. But it is always helpful to have a more formalized work plan, and that might be something we could do in the future. This board probably wants to be involved in that, I would think.
Yes, I would think so too. So I'd make a resolution then. I'd like to make a resolution that the Board of Health recommends or approves to move ahead with utilizing Mapc to perform an internal analysis of the health division as outlined in the scope of work presented today, and in the time frame that is presented, with the budget considerations that have already been discussed.
Second.
All in favor? Carrie?
Aye.
Paula?
Yes.
Rick? Aye. All right, great. Thank you, Mark and Barry, and I guess we'll be seeing a lot of each other over the next few months.
Congratulations
thank
to
you.
us on this. This is a big step.
Yeah.
Thanks a lot,
Big
everyone.
step. It's
We're looking forward to it. We're looking
really
forward.
happy to be at this place. It's great.
I think we're all going to learn a lot.
Oh, yeah.
Well, thanks, and yeah, we'll follow up, with Peter and Jean to, kind of move forward on contracting and those elements.
Terrific.
Thank you for
Thank you
having
so
us.
much.
Thank you. Good night.
Thanks again, gentlemen. Nice
Good
job.
night.
Thank you, Peter.
All right. Now, back to Jean for the grant update. So take it away.
Okay, thank you. So you all heard we got the grant, and it's exciting to be looking at a shared services grant that we were lucky enough to be awarded. There's lots of moving parts to it and lots of ups and downs. We, even from the very beginning, we had a few curveballs thrown at us. And the most recent one is that the town of Wilmington has withdrawn. So they were very much on board when we applied, And now they're very much not interested and have unpartnered with us. We haven't even started yet, but anyway, so we have been working with the state and attending, of course, attending the trainings. We were on with Carrie the other day. And the town managers are all talking to see if we can quickly pivot and find another community to meet the 3 community requirement. The priority, as I mentioned earlier, is to this point has been to focus on getting this health director position posted. And so the goal now is to figure out how to salvage what we need to salvage for the grant. It's my understanding that the state had a lot of excitement to get contracts out this week and so forth, but like everything, it's taking longer for the state to execute. The grant outline had indicated that they wanted agreements in place, I think it was June 30th, but I'm not sure that's even still a requirement. So we think we have a little bit of time to figure this out. As you know, Bob's been working hard and behind the scenes. So fingers crossed, we'll get that most recent curveball resolved and move forward.
So the timeframes that have been previously discussed seem to be like a moving target. Is there a drop dead date, where if we can't get a third community, and is Linfield is still on board? Is that correct or no?
As far as I know, I haven't talked to Linfield, but yeah, I having the 3 communities is the requirement.
Right. Okay.
I mean, at this point, we don't have any signed documents with anybody, and
okay.
I think the state realizes it's a little tricky starting a new region.
Mm-hmm.
So is there some way that we structured this that Wilmington backed out on? In other words, is there a way that we're going about this that maybe we need to pivot from to get another community on board?
I don't know anything about why they withdrew.
Okay.
Huh.
So I guess there'll be more to follow is basically what we're coming down to. Okay. I would agree that, in some ways the health director position recruitment is a very high priority, and if we can work on both of these things in parallel, great, and that's the plan. But ultimately, getting a health director is so critical to pulling things together, and particularly if we can get someone that it syncs up time-wise with the internal analysis that we'll have, we'll be in a really good spot. And as I understand it, the state is planning more of these shared services grants down the line. So if we don't get this one, we'll get the next one, and we might be in a stronger position at that point. So we'll see. We'll keep this on the agenda for next time. All right, Kevin, the coalition update.
Brief update. It was a really short meeting that we had back the end of April. One thing from that meeting, but something else after that meeting just to talk about. So they're starting a mapping project. Basically, they're going to be looking at how they work with the court system and how people interact with the court system and working to prevent people with mental health and abuse from ending up in the court system. So kind of like a comprehensive look at that portion of it. Obviously, that end goal is to try to keep folks out of the court system. So they're starting by looking at it from the aspect of how the interactions actually go. So that is going to be an ongoing project that they're starting up, and I'll definitely keep you more informed about that. It certainly could be some interesting findings and some interesting results that comes from that. That was really the only, I think, thing of consequence, or I should say just of, not of importance, but of kind of big items that they were going over. The nice piece, though, that came after that, I'm sure probably everybody heard about this. I know Kerry voted for it, I'm assuming, was a social worker to fall under the coalition. And right on the town, I've never actually seen this done before, successfully at least, where somebody got up at town meeting with a motion to essentially add a social worker under the coalition. And I was not in the room. Well, nobody was in the room, but I think it was an overwhelming vote to do so, to fund it, I think, through free cash.
Yes.
Is that correct, Carrie?
Yeah, there was a proposal on the floor from John Sasso to fund through free cash for a social worker position. Well, to pull $80,000 from free cash to fund a social work position for the police department. There was a lot of healthy debate or discussion, not debate, discussion, trying to understand, because it just kind of came out of nowhere.
Yeah.
It was, I mean, it was amazing to see support for something like that, and a beautiful thing. So, but so your meeting was before town meeting?
Yes.
Okay.
Makes perfect sense.
It does. I think it's going to be a great addition. I know Erica and
Yeah.
Sammy are really excited about it. They're working they're working right now to figure out, okay, what are we calling this? What is this? How does this look? How does this work? So they're kind of, I'll have more on that probably, because we're not meeting until next Wednesday. So I'm sure it's going to be a topic of that meeting, so I can report more back in June on that and have some more details on that. Right now, it was such a sudden thing. We only know that there is funding for it, and that's that. I got to go figure out what to do with it.
Right. I mean, there's a lot of different models out there, and there's ways to have them be, still employed by a social services agency so that they have access to information to provide services, or you embed them and have them go out on calls with police officers. I mean, so I'll be really interested to know more about what models they looked at and what they've decided they want to try and do.
Okay.
So
I can dig into that a little bit, Kerry, before the meeting with Sammy and Erica. Just to ask them to keep me in the loop with what's going on. I can report back to Peter.
Kevin, last time you mentioned a survey that the coalition was doing as part of this, looking at, I think it was substance abuse and other things. Do you think that'll be ready for us to review by next month, or is that a July?
I thought that was a late June. Let me just take a look at my notes here. I thought that was a late June that they were expecting to get those, to get it, to have it all kind of put together.
Yeah.
So you can kind of dig into it. I think I got a date, June 20th, kicking around in my head. I think it sounds about right. I don't have my notes right here in front of me, but.
So we probably look at maybe a July, having that on the agenda for July.
Yeah, I mean, we might, if it's
August or something.
Yeah, I'll as soon as we get it, and I'll make a note to ask that question next Wednesday again, just to have them pass it to us right away, so we could put it on for an agenda item. Can do that.
That would be great.
Could I mention quickly, Mr. Chairman, it's been important since I've been here that we had representation with the coalition. And I think this is the most important time to have that active representation. So thanks for everything you're doing over there, Kevin. But right now, more than ever, let's follow the buck.
Yep.
Yes. Yeah. I mean, I think, I mean, how it plays out will be interesting because I'm sure everyone was in support at town meeting, but with the concept, whether they thought how they thought it might be being delivered, I think varies a lot among folks. But I know there was a
Sure.
lot of trust and goodwill that they'll be able to figure out what is the best, what's the best first way. So I'm interested to see what the next steps are.
Yeah, as am I. And just from a budgetary standpoint, historically, this is even more unprecedented to just, I guess, put the emphasis on it. So historically, we do not want to use free cash to pay for a position. We use free cash to pay for one-time items, buying a fire truck, as an example, because it's a finite thing and we buy it and see you later. We don't have to deal with it ever again. This is an ongoing thing. So this is, it'll be interesting to see how this works into the budget, but the fact that town meeting overwhelmingly voted for a position be paid from free cash, as Gene can attest to, does not happen.
No.
So that shows a lot of support, I feel like.
Yes, and I'm sorry, I don't want, but I mean, I think what it does too is it sets the coalition up and the community up very nicely to be able to apply for future grants and support, because there's a basis, there's an infrastructure that you can then build upon, and that's a key element for funders. So if like Barnstable County has some wonderful arrangements, and in part that has to do with the fact that they have this baseline of service that they're able to demonstrate and build on, and funders prefer to support that. So
that would be great.
So I think it's strategically a very good move, and positions us well for future funding opportunities.
Rick, can I just pipe
Sure.
in one more time? And I'll watch my rhetoric because I tend to get on the soapbox a little bit. And Schwung's going to talk in a little while about her expanded role with the website. But, and I've already mentioned, how proud I am to just be a small part of what's going on in Reading. But I'm dismayed in a way that, this hasn't made more of an impact, in the headlines of what's going on out there with mental health. And I spoke to somebody recently and I said, what Reading is doing is really pulling this into the mainstream. He said, that doesn't make sense. Mental health is in the mainstream. It's just nobody's talking about it. And that's the point. No one is talking about it except for Reading. We spent over 5 hours earlier this month talking mental health, and it might have been the underlying piece between the tasers and then offsetting the tasers with the, and this is only my interpretation, but I watched it, I promise, offsetting the tasers with the personnel. And to me, that needs to go someplace else. So Schwung and I already started talking about, of course, Christine was involved in the conversation too, but this will get up on the website in some respect. We're going to watch how it happens, but self-promotion is something that I've done in the past. I can't do it anymore, but I really wish we had somebody tooting our horn out there.
Well, this is real forward thinking, because this is the next pandemic.
Yes, it is. Working on it.
Yep.
The tooting, sorry, working on the tooting.
Thanks.
Great.
I'm sure Senator Lewis would be very interested to know about this. I think I
think Reading can be an example for other communities at this
point.
point.
Agree.
Yep.
Was very proud to see the community coming in on that. Really exciting. Thank you, Peter, for reminding us.
Maybe when we have the coalition come back to maybe talk about the survey, there'll be the role of the social worker will be more fleshed out, and we could hear more about it at that point. Be interesting to hear how the thinking is going. All right. Thank you, Kevin. So moving along to minutes from the April 15th meeting. Everybody received those yesterday. any edits, comments, suggestions?
I did not.
You're okay?
Yep.
Just one thing.
Sure.
I just want to correct a spelling. Thank you, Jackie, on the, because it's the SAFE Act is referenced in the, talking
Yes.
about the, and.
I saw that.
Yeah, and it's, so SAFE is actually an acronyms, and it would be capital S, capital A, capital P, capital H, capital E. Some people say safety. I don't like that, but, but that's all. Otherwise, yeah, no comment. Thank you. They're great.
Great. Resolution to approve the minutes. Do I have a second? Second. All in favor?
Either one of us.
Paula, Carrie. Carrie, yes. Rick, yes. Approved.
Thanks for that clarification, Kerry, and thanks to the voting board for approving those. Nice job again, Jackie.
Yes.
As always,
As always.
Yep. Very grateful for you.
Oh, yes,
you have no idea.
really.
Yep.
May we never go back to that again.
Never,
Oy.
never.
But it was nice to have Jean visit me at home and hand out files of all these
Yes,
dozen minutes. Yeah,
yes,
I
yes.
guess that's okay.
So much work to get us to this place. Yeah, thank you. Yeah.
Okay, Health Division monthly report. Peter.
Yes, thank you, Chairman Rick. And I wasn't here for the dialogue that you guys were just talking. I just know there was heavy lifting going on. But as usual, I wasn't around for the heavy lifting. So all I'm trying to do now is keep it from sliding back and to where it might have been. I can only imagine, but let's keep looking to the future.
Mhm.
Absolutely.
And I will say, though, having just stated that today this has been a great week. I returned back to Danvers and I spent a lot of time in Reading, Monday, Tuesday, and Thursday. And just today I met with, and we're meeting face to face with masks on and outdoors, or indoors with masks on, which is one-on-one. But Jean Marcotti's been here. She's doing the animal health piece for us. And Dennis Palazzo has been here and he's doing some of the food safety plan reviews for us. I met with the nurses earlier today, Schwung and Christine, and it was really great to see these folks after 6 months of just Zooming.
Mhm.
And, you know, there really is, I think there's some chemistry going on among this team right now. And we know there's a lot happening in Reading and we want to see it successful. I met with Daniel as well earlier today. And, you know, I went on an inspection with him yesterday. We got a call in for a substandard housing inspection, and I'm glad I was available to go with him because, you know, what we witnessed was, you know, it's probably heading to a court. I don't know for sure. He has an attorney and all that business, but it's really at the time when I think it's Chapter 2 of the Sanitary Code, and it's the most challenging part, entitled Minimum Standards of Fitness for Human Habitation. You really need to know how to dot your I's and cross your T's. Together, Daniel and I did a great inspection, and I think we really complement each other. I mean, of course, I got the lip service going and in the experience, but Daniel is taking the notes, and when we get back to the shop, you know, we're ready to go and make a concise report. So that's where we are with that. And you know, there's been some discussion between Daniel and I, and as we go through this report, I'm going to ask for some action from the board. But did you get the report? If not, I can screen share here and just walk down it with you, and that might be the best way to go. Is that okay?
Yeah,
Yes.
yeah,
Thanks.
that's a good
That would be
idea.
helpful.
See if I can do that. And hopefully you're seeing a shared screen a little
Yes.
bit here.
Yep.
So under epidemiology, we're going to hear from Christine and Schwung. They're going to talk about the case counts, which is going to be really good news according to what we heard just hours ago. And other Maven data Christine will do, and vaccination programs Schwung can get us up to speed with, and that's been a very successful endeavor these past few months. Schwung will also talk about her expanded role, which I've tried to describe in a few words here and there on what she's doing with the website. And already we're getting accolades on the good work that's going on there. So the red marks here are mine, and I'll let the nurses talk to that in just a few minutes when we get to environmental health 1 and 2. The first piece, one is the food protection piece, and these are just raw data on the numbers of inspections that are going on a year to date and in the current month. And we can see that at the end, well, where we were today is we're approximately 60% through with our inspections for food establishments, licensed, permitted food establishments. And so there needs to be a little bit of an explanation there before I take any tough questions on that. And the story goes like this. About 2 weeks ago, I heard from our DPW director, and I think her name is, Jean's going to have to help me. Is it Jane? What's our DPW director's name, Jean?
Jane Kinsella.
Yeah, Jane Kinsella. And her concerns were the grease that is generated in part from food establishments getting into the disposal system, the municipal disposal system, wastewater disposal system, and it's costing her overtime and other expenses. So she asked if she could collect some data on the maintenance of the grease traps that each food establishment has under their 3-compartment sinks. Depending on the size of the sinks and the operation, there's a grease trap under there. And there is a regulation on the books here in Reading. It's passed by the Board of Health some time ago. I wasn't aware of it. We had one in Danvers, and I know lots of communities did adopt them for this very reason. So right away, Daniel and I put our heads together and established a setup where we could start to tackle the collection of data on the grease traps that hasn't been collected. I mean, I didn't have any records of it, and he was unaware that the regulation existed. So we took John off the job doing inspections and asked him to go and hit the food establishments that do have grease traps to let them know this is a requirement. It's beginning June 1st. We need to know what they're doing with the grease. I prioritized that because it was a matter of budgetary for DPW. And let's face it, when we have backup of wastewater into the streets or into the homes or food establishments, that's a potential hazard. So John took a break. He's done. I got a report from him yesterday, and I think he said he's been in 60 food establishments already. And just with the notification, we're going to follow up with an email to all our permitted establishments. And Daniel has set something up with IT where it can go right on the cloud, which is also known as OpenGov. They quickly developed a place for us to start collecting this piece of information. So that's not here on the report, except it shows indirectly that we've slowed down on our food inspections only because we needed to shift to something more important. The board needs to know that we do react when it's important enough. Excuse me. This is water. It's not Budweiser. It's a can just like the king of beers. My wife saw me getting ready for the zoo. She said, "You're not going to drink a beer before the meeting, are you?" It's like, dear, please. This is tough enough. So here's all the data we got. And I expressed down here that Daniel put this all together for us. And I'd also have an asterisk. And this is going to take a piece of explaining too. Because Daniel is, by his own description or judgment, is not real comfortable doing all the inspections. He hasn't had enough experience. He doesn't feel comfortable doing them without further, shadowing. I've asked him to please consider taking on a more technical role in doing the development of our cloud, our OpenGov stuff that is very difficult and tedious for me. There is, this week alone, we've had 14. I'm looking at my notes over here on my shoulder. We had 14 requests for permit reviews. I haven't gotten to them yet. I will get to them before they need the permit, but it's very busy out there. And now all the food establishments that have been coming in since back in February and March, I would have to open each one individually. And it's not a big deal. I know you can open them and then you click to find out that they have a food service manager's course. Do they have the dumpster permit in place? All these different little tags that go on. And Daniel reviews all these and he puts one note together and says, this is ready to be approved, but the director needs to approve it. So it's a rubber stamp, if you will, and I put that under the quote marks to open it up, get Daniel's review, and click the rubber stamp. I'm there, Daniel, if it's that simple, will you do it for me, please? It's clogging up my mailbox. I'm going crazy here. And we agree that that's not the right way to do it. So alternative to that, I want Daniel at my side, opening these up. And today we did Bunratty's, which I've heard of. I've never been there. I couldn't find it except with a Google Maps. And that's sad. To be a director of public health in a town and you don't know where the big restaurants even are. And so he and I sat and we went through this and I was able to ask him various questions about, so what goes on there? What is their menu about? And so forth. He's been there several times. Okay, I feel comfortable now closing this out and approving the permit. Daniel and I are not exactly seeing eye to eye on his role in this part of the process. I'm asking the board if they can at least, I don't care for a vote or anything on this, but I would like your approval to help me convince Daniel that he's best utilized right now. And I will have him shadowing me as well out in the field. I've offered this to Bob, to Gene, and to other folks too. I got a pair of gumshoes in the back of my closet someplace. If I have to get out and do some inspecting, I'm happy to do that. Daniel, follow me along until you get the feel for how you interact with the folks upon which you're inspecting. They don't want to hear bad news necessarily. There's a educative way to do it, and he needs to see this piece. And so he takes over some of the technical stuff with me sitting in front of a computer, and I take over some of the piece that, okay, let's go on into the field. You're gonna shadow me. So after today, where we did have a little impasse, and I don't know how far it's going to go. Daniel was upset at the idea of him doing this kind of work, and nothing we haven't been through before, and we'll get through it again. But if the board can see the rationale around that, I would appreciate it. And then I can go back and work with Daniel and say, look, this is important. This is what a health director does. The health director doesn't necessarily open up documents that are online all day long and click them off. So let's work together on this piece. Let's work together on the other piece. And I bet we can continue to complement each other. I'm convinced that it is a salvageable relationship still, and that we can end up complementing each other. Now that's my lengthy 2 cents worth on there. And I'll wait before I move forward to get any comments you have on this page that you're looking at. Everything from the inspections to the processing of how we're collecting this data in the field and back in the shop.
So my question to you, Peter,
Yeah.
Is there any of those other inspectors capable of taking Daniel on as opposed to you?
Well, Daniel brought it to our attention earlier this week that the YMCA needed a permit renewal, and he wasn't comfortable going to the Y pool to do the inspection. Now, let's remember when I first got here in November, he was taking classes to become a certified pool operator. And then I authorized him to go for 2 days in the shadow of an inspector in another town. I'm not certain which one it is right now. And now he's coming back saying, I still don't feel really confident going to some place like the Y pool. It's a big one to do an inspection. And in the same room with us was Dennis Palazzo. Daniel asked me to do it. I mean, are you kidding me? I haven't inspected a pool in a long time. I'm not the best resource for that kind of stuff. Dennis piped right up and said, I can do that. And I said, fine. Dennis, you take Daniel out and go ahead and do it. And I don't mind who does it. We would have to pay Dennis every time, and we're double paying, and I'm not. But if Daniel were to relieve me from some of the what I call clerical work or administrative work that needs to be done, then I'm happy to put some of my time towards, going visiting places with him that he hasn't had enough experience in. And certainly the housing one paid off yesterday, I'm sure. And I think it could be another example. So I think that 90 days, and I said this to Rick, and I said it kiddingly, but if I could have this guy shadowing me for 90 days, he'll know if he's an inspector or not. He's going to learn what it takes, a certain amount of savvy, a certain amount of base knowledge. Before your question comes up, Carrie, please, he's scheduled to sit for the exam, the NEHA, which is National Environmental Health Association exam, to be a registered sanitarian. That date is pat for September 7th. And I fully believe that he's going to pass that exam on the first sitting. So we're investing in him. I think his strengths are there, and we're recognizing weaknesses on both sides. And that we can, again, I'll use the word that we can enhance each other's roles. Go ahead, Carrie, I'm sorry.
No, don't be sorry. So I have one small request. Could you stop sharing screen for a minute so I can see faces?
I think so. Yep. Let's see. That should pop up somewhere. Stop here. Stop share.
There we go.
Okay.
Sorry. I just feel more comfortable when we're discussing like this. It feels better. So thank you.
You bet.
So I want to understand what the task that you're suggesting that Daniel assist with is the review of the documentation, right? Am I understanding that correctly?
Yes,
Okay.
it is.
Okay.
IT has put together this elaborate form, and it really is a time saver when you get to use it. And it has all the permits on there.
Yep.
And it's called OpenGov.
Yep.
And you click it open, and then you can review all the different segments of every permit that we issue. Yes.
Okay.
So the idea is to have Daniel, will you please open that? Will you please open the different sections and tell me when we get, and I, at the same time, can be having some dialogue with him. So like,
Yep.
What is this place like? What's on the menu? All right.
Right.
Now we get to the point where the director has to sign off, and I'm comfortable. I feel like I've walked through or I know something about it.
Yep. Right. And he's been trained, and you are participating in the conversation.
Yep.
And you're right. So, and what you're asking is that he do the, check the box essentially, and close out, and that is a way to, that's kind of some shadowing for him as well as out in the field, it seems to me. That sounds like it to me. I mean, it's a understanding of what the questions are. So I guess I'm trying to understand what if is the objection that Daniel feels that this is work that is below him or above
I'm
him?
not sure.
Okay.
I'm not sure. And I really don't care to speculate on that,
Right.
but
No,
there was a
not
little
with
bit
it,
of
but-
pushback
no.
on it. Nothing that I think we can get over it. I mean, these are things that happen all the time. And when your job changes a little bit, there's a little bit of,
Right.
what's
So-
going on around it.
Right. And I'm sorry, and I don't want to get too deep in it, but to me, what you're describing is a very reasonable thing,
Okay,
particularly it's under supervision, and others may have other opinions, but what you're describing is some close supervision and a structured kind of environment. And to me, it makes sense. And I do trust your judgment, but I'm certainly interested in what others maybe are seeing or hearing that I'm missing.
Well, I think my concern is mostly about the best use of Peter's time.
Agreed.
And if there are other people in the department that can have Daniel shadow them to learn what he needs to learn, would that be a better use of your time? I'm not there. I'm not working the day to day. you're a better judge of that, but I just wanted to make sure that you feel like this is the best use of your time.
We're trying to develop Daniel. The
Right.
town has invested quite a bit in getting him enrolled in the program where he can become an RS and pay for in the time it's going to take. So we want to give it a best shot. I would love to be able to turn the department over to a new director and say we got a senior and seasoned health inspector. We have 2 nurses and and we have some staff that would help us continue going in the same direction. I mean, to leave a gutted department to a new director is not my idea of, completed work.
Great.
Okay.
I would, oh, go ahead, Kevin.
Oh, thanks. My only question would be, what is the new health director? Is this going to be a continuation for Daniel, or is that all of a sudden now it's going to cease and this is part of the new health director's day-to-day operation?
No, it's not part of the new health director's day-to-day operation. Trust me.
Right.
But I envision at least 90 days before someone is up and running. I know for a fact that Daniel is set for September 7th to sit for the exam. So 90 days of him working close with me, passing that exam, me going out one door would leave the new director with someone that he can count on or she can count on to do the work that needs to be done on the environmental health side.
Right.
And I'm willing to do that. And that's all I can say.
Okay.
Okay.
I mean,
I would just say I'm also supportive of that approach. It would seem to me that for Daniel, if he's feeling insecure around some of these inspections, that it would be a boon for him. It would be a really good thing for him to have an experienced person accompanying him and sort of teach him the ropes and gain experience. And so, and it sounds like you're willing to do that, but there's, in a very small department, everybody has to be a little bit of a jack of all trades, and there has to be some redistribution so that of work, so that can happen. And so I would just say I'm supportive of that. Carrie?
I'm sorry, I thought I'd do this. I thought of one more thing. So it sounds like there's 2 things happening. There's the in the field shadowing, and then there's the administrative documentation aspect. And both of those pieces are critical for a successful environmental health department.
Yep.
And it seems to me like Daniel's getting a good opportunity to work with a very seasoned and qualified person to be exposed to considerations in the field and administratively behind the scenes. And that's very valuable. That's like a private class. I just want to make, did I get that right? It's 2 pieces, right? It's the
Yes, it
administrative
is.
and the field. Yes. Okay.
And you're kind of scratching each other's backs.
Yeah.
I mean, I hate this screen at this age with the amount of hours I'm putting in front of it is, I don't know if you want to call it annoying, but I mean, it's not what I expected to be doing at this stage of the game. So yeah, I could use some help.
Yeah.
And yeah, it is scratch. Thanks, Paula. That is a good down to earth way to put it. Come on.
Yes.
So Peter, let's wrap up on the report.
Thanks. The second page here then is other environmental domains. It's pretty straightforward on this stuff. The infection control is the piece that always has me scratching my head about, and that has to do with complaints coming in about people not wearing masks in public establishments like supermarkets and so forth. And we were getting those cases brought to our attention, but as you can see, those have dropped right off month to date. Now it's down to 0. So finally, we get to the point on the ancillary work with the public health emergency preparedness, and we're not meeting as command anymore since last month. And I'm not going to give a comprehensive explanation of that right now. I think I would have to prepare for what happened that day, and there's a lot going on at tonight's meeting. But I can thank Rick for getting me fired up for that meeting, and Kerry was there too. But we stopped meeting as command and let the Board of Health be the Board of Health. And everybody agreed. And so that's why the website has changed and so forth. Emergency dispensing site is not applicable. Regional public health emergency preparedness. I still meet weekly with the 3B health directors, and those are valuable meetings to me. We exchange a lot of information, including some stuff we might hear from Christine when it gets to that piece. So global, I had to scratch my head the other night after a long select board meeting when this came up and this is Rick's last revision. Any global updates? Bob had shared with me some kind of an alert from the Seychelles, which are somewhere off of East African coast, where COVID is actually rising, even though everybody has been vaccinated. And I'm like, Bob, what do you do? This is your form of entertainment after a long select board meeting. And it came out. And so I just share that, no, we're not doing anything. We're hardly able to think globally. We're trying to act locally right now. But as long as that was there, that was there. One thing interesting came up through the high school and environmental health club. They wanted to start doing something with composting. So I documented that. I've been talking with the advisor down there, and I don't know where it stands, but okay, set them off in the right direction. And the staff development, I'll end up with this thing, and it's on a very positive note that Daniel is scheduled to sit for the RS exam on September 7th. That's the report for this month, as far as I'm concerned, with the exception of the all-important nurses reports that belong up in the top half. So I'm ready to pass that along to those folks if it's okay with you, but I'll take any questions in between.
It's good.
Let's see. Schwung and Christine, you guys ready to go? Can we start with Christine, I guess? She has good news. Such good news.
Sure.
Thanks, Christine.
Sure. Yep. Good evening. So it is good news to see that cases have been coming down and have been staying down. The total case count is 1,912, and I did run a report with Maven, and that is an accurate to-date number. Total active over the past week, new cases has been 7. There's been a couple of days that there's been no cases to report at all. Those were good days. The nurses were really happy to see that. Total deaths 49, total transferred 10. Those numbers have not changed, I would say, over the past 6 months. And total recovered is 1,846. I had my weekly meeting with the Reading High School head nurse, Mary Juliana, and have some good news on that end as well. There is only one case at the Reading High School right now, a staff member. However, there was some pooled testing done, and it did identify a positive pool, and they are being quarantined right now. That is at the Coolidge School. And as far as Austin Prep goes, there are no new cases to report, either in sports or any other students. And with regards to businesses, there are no clusters in the community right now. And with regards to a vaccine update, and I know that Schwung's going to be speaking more to this, but some good news. I was able to forward information on PelMed to the head nurse at the high school. and she is going to utilize PelMed. She got approval from the school administration to hold a vaccine clinic on 5/26 and 5/27 to vaccinate ages 12 plus. And I know that other communities are also using PelMed. So that's a really nice thing to offer.
Yeah, can we elaborate on that just a little bit? PelMed is an independent group that does these vaccinating
Vaccines, yeah.
clinics.
Vaccinators, yeah.
And I don't think the school was aware of this, but Christine certainly was, and she brought it to the school's attention, and the school did act upon it. So we're very pleased that, you know, because of the network, they were able to hear about this, and Christine just, you know, right at the cutting edge, moving things in the right direction. So thanks for sharing that, Christine.
Mm-hmm. I will say that I feel like I have a very good relationship with the school nurses, as well as the senior nurse advocate for the senior center. And I realize that the guidance, the new guidance that has changed recently, there's been a lot of questions. So I am, you know, working in collaboration. There were some questions with regards to the opening of the senior center. So I'm happy to assist and, you know, help out with that in any way I can. And just a couple of other miscellaneous things that I wanted to mention as well. I know that Shuang has been working really hard to update our website, and she will continue doing that. I think that's extremely important. There's been several calls that have come in, and it's been really nice to be able to give them a consistent message.
Yep.
To, you know, to refer to. And then just a couple of other things that we discussed today during our meeting. Shuang and I will continue to meet weekly just to go over some nursing issues or any future things that are important to work on. Some of the things that we talked about today were there's been a few cases of Lyme disease we're seeing that come about. I'm sure over the summer there'll be foodborne illnesses. I was just on a call with DPH about just, you know, again, some of the foodborne illnesses you see more so in the summertime.
Vibrio.
And yep, Vibrio. Yep. And just, and then just some other things that would be nice to work on for the community in the future, like, you know, skin cancer awareness, tobacco smoking cessation, the behavioral health issue I think we talked about earlier, alcohol and drug addiction and depression, and just some of the sequelae we're going to see. I think you, Carrie had mentioned earlier, the next or Paula, the next pandemic we're going to see is, you know, unfortunately, some of the fallout from COVID.
Yep. That was Paula. She's absolutely right.
There's a cherry on top too, Christine, and I'm not going to steal your thunder, but what about the plans for a high school prom?
Yes. So I did get a chance to speak with them at the school in depth, and I asked Mary to review the plan in full. The good news is it's going to be held outside at a venue in Topsfield, and it is in a pretty large area. I do believe that they are going to continue to still do the screening, even though some of the guidance has changed. And Mary and some of the other school nurses are going to be present there, which I believe is it's a nice thing to have.
That's above and beyond the call of duty. Very nice.
Yes. Mm-hmm.
That's an excellent report, folks.
Yes.
I mean, it really shows where we're going here as a department, and, you know, we're not in anybody's faces, but we are doing a good job monitoring as we go along. Thanks a lot, Christine. That was great.
Thank you, Christine.
Yeah. Thank you.
If there are no questions, then for Christine, we can save them up too, and we'll hear from Schwung next. She usually has a visual to go with her presentation.
Sure.
Oh, before we start, I'd like to acknowledge Schwung finished her studies. She's now an MPH. And I'm very
Yay,
proud of her for that.
Thank you.
You
congratulations.
know it. Well, that's such great news.
Yeah, it's so great to put my foot into public health before I graduate. I really learn a lot while I'm studying and have some practical experience. That's
Yes.
wonderful. Okay, so yes, as usual, I have some slides to share. So can you see my screen?
Yes.
Okay. So today I'm gonna talk about the COVID vaccination updates and our town website updates. So in the past few months, we admin total 1,121 doses of COVID vaccine. They include Moderna and Johnson & Johnson vaccines from our town of Reading clinics and the homebound vaccine delivery. And 66% were mainly administered at the regular clinics at Pleasant Street Senior Center and one clinic at the Reading Memorial High School Field House. 9% were used for homebound individuals. 14% were given at Frank Tanner and Cinder Glen affordable housing. And the other 11% were given for Council on Aging program. And so in total, 567 individuals were fully vaccinated from our clinics. And here is the data of fully vaccinated people in different age groups. And you can see 173 people aged 75 plus completed their COVID vaccine series from our clinics. And so this is the Reading Weekly COVID-19 vaccination data report from MassGov. It includes the overall population in green and the number of fully vaccinated individuals in blue. You can see over here, about 90% of elderly population, people 65 plus in Reading, was fully vaccinated. And according to this report, about 52% people age 12 plus were fully vaccinated in Reading. And you know, starting from last week, people aged 12 to 15 years old can get Pfizer vaccine. And thanks, Christine, to provide the vaccine clinic resource information for our students to get the vaccine at Reading Memorial High School. And hopefully, our youngest age group could have more fully vaccinated people soon. And here are some changes and updates for our website in these weeks. With the help from our public information officer, Jane Wellman, we have unpublished the urgent alert on our town website and combined all the COVID-19 information to a yellow button on our main webpage, Health Department page, and Board of Health webpage. I'm just gonna share with you our website. Can you see the website page?
Not yet.
Down in the corner.
Okay,
It didn't open up.
okay, let me just switch.
There it is.
There it is.
Okay, great. Yes, so there used to be a yellow line, a red line. It's contained urgent alert information, but now they all goes into this yellow button, COVID-19 info. And we have some different parts, like the vaccination video, reopening Massachusetts, vaccine information, COVID-19 dashboard, and some other COVID-19 resources. So for example, like our reopening Massachusetts page, we have some mask guidance. This is the mask order issued on April 30th by the Governor Baker. This will be updated after May 29th because we may have some new guidance from the mascot. And we also have some tips for social distancing. And down here are our reopening plans from mascot. Like on May 18th, we have some updates for school guidance. And May 29th, we will have some new information for the updates, like all industries will be permitted to open and with some instructions. On June 15, Governor Baker will end the emergency order. We also have the link to the direct to the mascot about our reopening announcement and Baker administration to lift COVID restrictions on May 29. We also have some mandatory workplace safety standards down here, and the residents can review it from our website. So for our future plan, we're gonna have some community health education information, including the disease prevention and the health promotion information, like the sun screening methods, any communicable disease preventions, flu vaccine in the flu season, as well as some behavior health information and education of like alcohol and drug abuse, etc. So that's gonna be our future plan for our website. So that's it. Thank you so much. Do you have any questions?
One, Sean.
Yeah.
On that future plan, is it your thought to perhaps include links to say the coalition that's in here in Reading?
Yeah.
Okay.
Yes.
Great.
That's,
Perfect.
We really like to work with the coalitions and provide information for our residents, so they can just visit our website and have the direct link to what resource they need.
Beautifully organized and very simple. It seems very user-friendly. Great job.
Thank you.
Yeah, excellent job.
And this is just the beginning too. I mean, right now we're just transferring from one place to another. The part that I like best is when you go to the town website, there's a link that takes you to the health page, and that's where you're getting everything health. And so we're trying to take full advantage of, you know, while we have the spotlight on us, usually we get tucked way behind public works, recreation.
Yep.
I'm sorry,
Perfect.
someone was ready. Oh yeah, the Kerry.
Shwag, I want to commend you on the work that you did with Jane. The rapid and somewhat confusing release of information has been challenging and continues to be challenging for everyone around the state, and really nice to see that you were able to stick with what I call the through line, right? This is the important information. This is what we'll distill. Really, really nice, because this is a another challenging set of circumstances. So really nice to see that result on the website. Thank you.
You.
And thank you to Jane too, because I know she's great to work with. So, yeah.
And again, I would thank Schwang, Christine, and Peter because last week, with the sudden change in guidelines, they were peppered sometimes pleasantly, sometimes not so pleasantly, by athletic directors and coaches and other people who, said, can we now not do this? And of course, there was a lot of confusion and a lot of issues around the dates and so forth. And I know that was a difficult week or so to deal with. And hopefully we're not too far out from under that in the next week. I know I had a long discussion with the select board about them having in-person meetings, and it sort of becomes all moot, with the changes in the guidelines. So
that means we're going to meet in person next time?
Ah,
I don't think so, but soon. Kevin.
Yeah, just in that light as well, Richard Schwang, great job again. I think the website is really, as Kerry mentioned, it's concise, right? Here's the what you need to know. Don't worry about the rest of it. Here's what's challenging. And tying into what Rick was just talking about, I think we should have a little promotion through social media and other means that the site is up and running. It has answers to all your questions. This is your resource moving forward, that it's been diligently worked on and will be diligently updated. I think trying to precondition folks to say, when it changes again, rather than peppering Peter with questions. Oh, I got to go to the website. They updated on the website. If the information's there, that's where I can get it from. So I think we should promote it in that light a little bit using our social media means. I know you can probably get with Jane to work on that type of quick bullet messaging on Facebook and what have you. Are we on Twitter by any chance? I don't know. As a town.
Good idea.
not a lot of body language going on around
I
that
don't
question,
know.
Kevin.
I'm not a Twitter person.
Oh,
Yeah,
God.
neither am I.
Twitter is sort of a second stage thing. You need to be able to walk before you run. Twitter is running.
Yeah, thanks, Kerry.
That's my assessment. Yeah.
I'll buy it.
Okay, Kerry.
Yeah, I did have a comment. I know as it says on the agenda, there's a pertinent incident command updates, and there was a fairly abrupt ending to command meetings, and I am interested to learn more about that, because the things that I've heard being discussed tonight indicate to me that there's still great value in command meeting and supporting each other from time to time. We are still in the midst of an active response. There's still homebound services being delivered by fire with collaboration with the school department. There's policy decisions that are being made in what I think are probably lower levels, and the lack of coordination in what is a fairly chaotic environment now with the lifting of restrictions concerns me. So I look forward to hearing more about sort of what informed that decision. I know command is still active, and I would just encourage us all to not think that it is done. This incident won't be over for a while. It is a public health emergency, but it's a whole of community response, and that's the way that you succeed. And I don't want to put too much weight on the health department to be trying to solve all of these things and being peppered. I think that we might have been able to avoid some of the peppering if we had command and maybe had a little work with the schools to get ahead of it. Not always, because nobody knew that some of the things were going to pop off as fast as they did. But I understand not wanting to perhaps meet weekly, but command's there for a reason, and joint command and active response phase, and even through our recovery, we still need to do hot washes and so forth. So I'm interested to kind of see how we move forward with this.
Rick, can I just share with Kerry and everyone else this piece? I agree with you 100%, Kerry. When I was here on Monday, I made a point to go over to the fire station. I'm sorry I missed Greg, but I did see Jackson. And, it's clear we bonded a lot over the last few months. And that doesn't just dry up and blow away. We got invited, as you know, to do a command meeting across the region and see what that's all about. So, the language is still is there, and so is the friendship that we earned. So I don't think it's just disappeared. And the after action report is going to be an interesting task too.
Sorry, wasn't suggesting it had disappeared, but things like the
Okay.
senior center discussion, things like the prom and the like, I think there's some utility to having the conversations in the room where the department heads and the leaders are actually aware of what's happening together. That's my point. I don't suggest that it's over, but we're still in an active incident. And I'm glad to hear that. Obviously the relationships don't go away. That's one of the lovely things about this community. Folks are in the relationship, but trying to, coordinate decisions is tough. I know there was an issue with release of guidance by EEA that youth 18 and under didn't have to wear masks, and the high schools sent out their notice because DESI had not amended theirs and they were behind on it. And they're just little things that we don't have to do what the state's doing with having different hands doing different things. We can be better than that. And that's what I would like to, that's why I'm interested. Trying to make people's lives a little easier, smooth the path.
No, thanks. I hear you, and you do make some good points. Let's think about it.
All right, I think it's probably it for this evening.
Jean?
Yes, go ahead, Jean.
Yeah, I just wanted to also just make one point about town hall reopening. And as Bob mentioned at the select board meeting the other night, it's a ways off because we're still putting the facility back after a major flood that we had.
Oh, no.
Yeah, several weeks ago we had a flood from a plumbing issue, and so that we're still in the process of renovating. So we're really not ready to open. But one thing he did ask me to pass along to the board was, when the time comes that we do reopen to the public, as you know, we've always been open by appointment only, but when we're fully opening the doors to the public, he wanted to just make sure that some of the things that we've talked about, like contact tracing and that kind of thing, that would be something that I assume when all the restrictions are lifted, that's no longer necessary. But I didn't know if the board had any thoughts on that, or if there was anything that we should be thinking about in terms of, we just all of a sudden open the doors and we know that there's no more masks, but what about contact tracing?
I kind of look at contact tracing as not something that's actually COVID specific. It's a general tool used in public health when there's a communicable disease, and it's done for tuberculosis, for instance. And so just on that point, I defer to Peter, but I don't think that goes away.
No, in fact, we spoke to that point earlier with Schwung and Christine. And, you know, Maven is going to continue tracking cases as they're reported. And there will be a time, Gene. I don't think tonight at this time is the best time to make a policy around that, but we're thinking about it. We're thinking about, you know, the term contact tracing was just one element of disease investigations. And, you know, we heard from Christine earlier, she's taking some in-service on some infectious diseases that are waterborne and foodborne. So it's ongoing. And let's see, let's wait a couple of weeks, and by our next meeting, we might be able to have something we can sink our teeth into, I guess.
Thank you.
So our next meeting is June 17th.
We got Kerry up there.
I raised my hand, sorry, and this is important. So sorry. I believe that this Board of Health voted to close the senior center early in the pandemic, and I don't know that we have taken a vote to reopen it yet. I know that had come up. I don't know if I just one of you said reminded me of it.
That's a good point. I didn't know that there was a formal.
There was a formal vote
So-
to close. Yeah.
Yeah, and not just that, it was town hall, it was the police and fire stations as well.
Hmm.
So those are things this board will have to reverse at some point.
Well, but Christine mentioned that she's working with the senior center, for instance, and I had an opportunity to speak to Kevin as well this week. And, you know, they're interested in starting to look at events and how could we begin to reopen. So if that's the case, that there was a previous resolution, and also for the police and fire stations, you know, maybe we should make a resolution that that we authorize our agents to begin discussions about the, you know, safe and orderly reopening of those 3 facilities. You know, I would keep it open-ended. I'm not saying open it because it's a lot more complicated than that. But
This seems to be exactly what Carrie is talking about in terms of command.
Yeah. Yeah.
This would be one of those discussions.
yeah, yeah.
Yep. I mean, ultimately, the vote comes back to us because we were the body that voted.
Right.
But you're right, Paul. I understand. Yes, I mean, I'm supporting completely. But this is the command. This is the, well, what does this mean? And that's an opportunity to work out the questions and answers in a thoughtful fashion, or even if a half thoughtful fashion, at least working them out.
So,
Yep.
I was going to say, a former member, Ellen Shonkoff, put together a Excel spreadsheet. I was looking for it the other day because I was just wondering about what we did and did not do as far as closings and in regards to the mask order when that first came in. So I'll have to reach out to her to.
Oh, look at this.
Look at that.
Gene, you're amazing.
There it is.
No, it's way more than amazing.
Yep.
So
Yep.
this is a good resource to probably, maybe you could send this back out to all of us, Gene, so we can just be familiar with what we need to do and what we have on, what we did. I think he had it broken down to state did it, we did it. It was set up pretty good if I recall.
Right. And I think we may have said it was okay if they wanted to lift, but I think the senior center is the one thing that we didn't address. We haven't addressed specifically as a body. I know
Correct.
Bob came and talked to us about town hall, and that was shifted to, you know, accommodate the changes since, you know, the work that you all were doing back last spring. But Pleasant Street, you know, that senior center just stayed closed. So I think that's the thread we need to, well, the loop we need to close, right? Is that what we do? We close loops.
Yeah.
Yeah.
Can I pipe in here for just a second? I don't want to take any time away from the board, but something of this magnitude needs some thought. And I wasn't here when this all occurred, and I'm hearing it now. Basically, I was disregarding any of Kevin's remarks about you need permission from the Board of Health to open. No, the Board of Health, in my view, had agreed to follow the guidelines from the governor. If this is not true, then everything Kerry just brought up here in this 11th hour needs to be addressed. And it would be my thought to give me some time to pull it together. We can have another. We'd have to have another meeting on this, and I would follow back again on Kerry's idea of drawing in command so that we could. And I'm not sure the mechanics right now because it's like 9 o'clock. Let's get a fresh start on this, but we can't let it ride.
Right.
Oh, does it make sense to forward that that draft that Jean just
Absolutely it does. I've never seen that. I heard something about it from Kevin, I think yesterday afternoon.
Yeah.
Thanks for
Eleanor was
pulling that up.
excellent
Jean.
at compiling the-
That was awesome.
Thank you, Jean.
Yeah, thanks a lot, Gene. Why don't you wait till 11 o'clock?
Oh,
I'd have really been at my
Whoa.
wit's end by then.
no, that was awesome.
It was
Totally awesome. I know, I'm blown away.
My only hesitation with that spreadsheet is it hasn't been updated since last November. So
Yeah.
I don't want to send around bad data that looks like it's all very tidy. So maybe Peter and I could work together and see what we can cobble together to update it,
Okay.
sharing good
Yeah.
information.
But this needs to
Okay,
be fast tracked. I mean, we got to catch up to the calendar if we
Right.
want to be, in compliance with our own,
Yeah.
rules, so to speak.
I mean, my understanding is the senior center is getting ready to open up and do events, but they're a little ahead of us.
Absolutely ahead of us.
No,
Yeah.
we're behind them.
Yeah.
Based on
way
my
to look at it.
conversations with Kevin Bowmiller, they're looking at after the state of emergency is lifted.
Okay, that's good. So there's not an urgency. That's good to know. That's great.
Yeah.
Thank you, Jean.
Okay.
Is this something that we can have this discussion at the next meeting? I mean, would that be timely enough? It sounds like, and I think Peter is right, pulling together, looking where the resolutions have been, talking to these entities about their plans, maybe having an incident command meeting, before the next board meeting, and then figuring out how to proceed. That's going to all take some time. And I think coming to the board, there ought to be that kind of pre-work done.
When's our next meeting scheduled for, though? Because the state of emergency is scheduled for June
The 17th.
15th. Yeah, so we'd be behind because the state of emergency is lifted June 15th. So
Right.
could we meet for one vote in 2 weeks' time? Is that enough time, or 3 weeks' time, or whenever, people are ready?
It would be June, if it was the first Thursday, it would be June 3rd.
Yeah.
But there's the Memorial Day weekend in between there.
Right.
But just because that's lifted, that doesn't mean anything necessarily has to change. Towns and cities are still able to do things all, completely independent from what the state is doing. So I
Right.
would find out, is it a timely thing to, in other words, are they planning like the 17th to do something? And if
Right.
they're not, it could probably wait until
Yes.
the next meeting. So
Yes.
maybe we could find out
Yeah, the senior
Yeah.
from
center,
Kevin.
they want to open, I'm going to say the 15th of June is when they're targeting it.
Okay, so they are targeting that date.
Yeah.
Okay.
But they could wait till the 17th as well.
I don't think so. No, the phone is ringing off the hook.
Yeah.
Days.
I don't think the clients are interested in waiting.
No. No.
I mean, we're talking about a
Can we?
paper, doing something on paper. We could do it as a single vote on a single
Right.
night
Right,
Yep.
and
Yeah.
so forth.
right.
I mean, if it makes sense to anybody else, I would suggest Jean's idea of let me regroup with her going through this. We might even want a town council to weigh in on it. I don't know yet. But we can pull together a command meeting. And I'm looking at my calendar. The week before the 15th is a Thursday, the 8th. And yeah, you know, there is a Memorial Day in between, but that's, I mean, still gives us 4 or 5 days to do this and make it happen. And what are the consequences otherwise? I mean, if the spirit of our regulation is being followed, and here we are getting it captured in minutes, that it is our future intent to walk this back. I mean, where's the foul? Where's the harm?
So what are you proposing?
Peter, I'm sorry, it's Christine. Could I just make one quick statement?
Yes.
I just, in speaking with members of the senior center, if I could, and I'm not saying, you know, any decision had to be made. I think Kevin had stated that even though the guidance is out, you know, we can still go maybe a little above and beyond. And I'm not necessarily saying that we have to do that, but it is a vulnerable population. And I guess that's just, I just wanted to throw that out there, just something to consider.
You lit a fuse now, and that's
Sorry.
going to complicate things, I'm afraid. But it deserves your attention,
Right.
you know, our attention. I certainly
Yep.
say that.
Right. I mean, as you said, Kevin, that cities and towns can do more restrictive than what the state is doing. And I mean, I guess that's the question is, it's what I hear Christine raising is at least we need to consider it. It sounds like there are concerns that our experts have that they'd want to weigh in on.
Are is the fire and police stations, are they clamoring to open as well?
Well, they've been open.
They've been open.
Well,
They
they-
took care of that.
Right, they've been open in a limited way, right?
No,
So-
they've been
No.
open. They've been
We-
open.
They have.
We
So
took
they're open
care of that.
Public again?
Yeah.
They never
that.
closed. They only stopped selling like some of the stickers and a
Okay.
few other minor things. So
Okay.
police and fires, it's really the Pleasant Street Center. Town Hall, I think we had discussed before that the guidance was, you know, fill out a form and self-screen and all of that. So that was why I had asked the question earlier. But the Pleasant Street Center I think is probably the most important thing to discuss and think about.
Yep.
And we have been working with town council to understand the guidance and some of the nuance. One of the people on town council used to work for DPH, so we've been getting good guidance from them. Because I think when we had talked about reopening the center, but Peter, correct me if I'm wrong, was my understanding that the board felt comfortable having staff kind of work through some of the slow reopening of the center.
Well, yeah, we had a formal discussion about that with, not but necessarily for the center, but with all these civic functions. And that was clear, and we've been in agreement from month to month on that. But the sticking point is we actually took a vote
Right.
that now has to be rescinded.
Yes.
And it's almost a technicality, but I don't like sidestepping
No.
something as important as the authority of the Board of Health.
What if we
Why can't we do that?
had a special 1-hour meeting, June 3rd, that was just focused on the senior center with the expectation that Kevin would come or whoever, you know, who's ever the appropriate person, having worked with the health division staff and come with a plan for reopening, that we could then take a vote to, you know, to to rescind our previous order. So we could have a really focused meeting just on the senior center and then allow them to, and we would have it with some information about how they would plan to do it. That would be one way to be timely enough for them, but not necessarily have a full board meeting otherwise.
Mhm.
Is
Yep.
that doable?
I support that.
Okay. So let's plan for the first Thursday in June, which is June 3rd, you know, for maybe 7 to 8, 7 to 7:30. It might not take that long depending on, and have the nurses and Peter work with them to come up with kind of a plan that you can present, and then we can, if we feel comfortable, we can rescind that order from last year. Okay,
Sounds good.
sounds like a plan.
Yep.
I just want to wrap up with a couple things. One is we need to have a reorganization vote probably at our next June 17th meeting. Apparently the bylaws, as it's been pointed out to me, says we need to have one between June 1st and July 31st each year. So even though we've already had one in August and November, we have to have another one. And so just be thinking about that. That's for election of the chair and vice chair. The other thing that occurred to me, and we'll have to see what happens, is the state of emergency changed elements of the open meeting law, and it's not clear what's going to happen in the next few weeks with the governor and the legislature about revoking those changes, in which case I don't know what that means for this board in terms of meeting in person versus continuing to meet this way, but stay tuned and read the newspapers and we'll see what happens.
Check the website.
That's it. Yeah. That's it, Peter.
Yes.
Push that out there.
And finally, I just had this idea. I'm just going to throw it out. I haven't cleared it with Peter yet, but you know, one of the things in healthcare that's very common with hospital boards and you know, boards of large practices is to begin a meeting with a patient vignette. And the idea is that there's a brief presentation, 5 minutes of a patient case. Often it's around patient safety related issues. And a presentation of the case, what happened, lessons learned, and so forth. It's something to think about. What we might do with this board is it wouldn't be about a patient, but it could be about an inspection. You know, something that happened in the previous month where there was an inspection and these were the issues that it uncovered that were particularly interesting, and this is how we dealt with it, and these were the lessons learned. And you know, the value of doing those kind of vignettes, if we decide to go ahead, and maybe not at the next meeting, but at some point, is to do two things. One is to educate board members as to what is actually happening on the front lines, where they're responsible for what's happening on the front lines. And so you actually get a real flavor of that we don't typically get just looking at, you know, the data set. And secondly, it would help educate, I think, all of us as to some of these, you know, extensive regulations of like, what do you do when you're checking a pool? Or I never heard of grease traps before. You know, it would just be interesting, I think, to do it. I wouldn't want it to take a lot of time. You know, it could be a 10-minute piece, but it's something to think about down the line. In any case, I think that is it for tonight. Any other comments, questions, additions? No. Move to adjourn.
I would second that.
Okay. Roll call. Carrie,
Yes.
Paula,
Yes.
Rick, yes. See you June 3rd.
Thank
All
you,
right, have a good
everybody.
night, everybody.
meeting.
Night.
Thank you.
Good
Thank you a
night.
lot.